This
Um,
conference will now be recorded.
Okay, so I'll start again. And so today's meeting, what I'm going to do is we have two separate processes listed as process of the business support task force and timeline. And then the next item is to discuss the membership for the task force. But what I'm going to do is I'm going to just kind of combine those two things into one for the sake of brevity. And I ask that any public comments be held off until we discuss it at the end. And if we could ask you put your name and the organization that you represent on the chat box, and we'll take the questions or comments in order. Okay, so the task force, where we are is we are at the phase of collecting applications. And we have like overwhelming positive responses from the community, from all sectors, from businesses to healthcare to restaurants and nonprofit. So I feel very, very powerful and grateful that our community is coming together to support this I don't want to say an issue problem, but this thing that we have to get over together as one. But right now, in order to do it, to support the businesses to be able to continue or restart while keeping our community safe so that the employees can be safe, as well as the customers can be safe, as well as the workers who are working together and creating safe environment. We need to come up with guidelines that can work for everyone. And it's a very complex process, so we don't want to just do it, without much thought. We want to be thoughtful and make sure we hear from everybody, because community voice is very important in this process. But right now, where we are is we are taking where we have the applications. The deadline was yesterday at 5, Thursday at 5. So we're not taking applications anymore. But we have the application, and we're going to go through the applications and figure out how to create the task force. So that's where we are. As far as the timeline is concerned, we are sort of kind of at an impasse right now because we need to go through the council and they have to sort of kind of give us a green light to create a task force and continue on. So there's kind of not much we can do about that right now. So we can do our process of going through the application and reviewing and discussions. But as far as carrying on any forward motion, that's kind of where we are with the timeline. And as far as the membership is concerned, like I said, we have a lot of contributions from all sectors, and I am so grateful for that. I just feel like Whatcom County is just one of the most, it is the strongest community I've ever lived in, and it really it warms my heart. I feel like we can do this together. I feel very hopeful about it. But it's kind of but at the same time it's a daunting task because so many people have applied, and we want to honor everyone. It's going to be kind of complicated, and we have lots of brilliant minds on our committee to figure out how to do this in a thoughtful manner. That's kind of where I am. And so, Erica, do you have anything else to add?
Sure. Yes. Thank you, Tina. I've gotten a lot of questions, and there has been some confusion about what this group is and what this group isn't. And I just want to clarify that for members based on our conversations with the subgroup that's been meeting, but also just based on the public health approach to this work. So our focus as public health professionals is really on that technical assistance on specific measures related to infection control and social distancing. and having those provide support and guidance for businesses as they open. But we as an entity, and the health department as an entity, will not be responsible for nor empowered to allow businesses to open if they can reach those measures. That's purely the governor's role. So the governor will provide guidance in a half hour, and he will continue to do so. And at that time, businesses may reopen based on whether or not that's allowed by the governor. What we're trying to do is really focus on that public health prevention approach. So making sure that when the governor does give the green light to certain businesses to reopen, that they feel confident that they have the measures in place to protect their staff and their customers. So we are not the body that decides which businesses open and which businesses close. We are the body that provides that assistance. So when the governor decides which businesses open, they'll be ready, and they'll have the support of public health professionals and the guidance from this group as well, and the task force.
Thanks, Erica. Does anybody else have comments or questions right now? PHAB members? I said I said we need to kind of go through it fast, but it's only 10 after. We do have a few minutes. So Leah, do you have any questions for us?
Not at this time, thank you.
Yeah, this is Bill Angel. I just wonder if you could hear me.
Yes, go ahead.
I'm curious, do we have any intuit on what sectors the governor might be looking to okay?
I could speculate, but I think we will find out in 20 minutes. So I don't want to misspeak on his behalf. So is it okay if I just kind of defer to the governor in half an hour?
Makes sense.
I want to thank Bill, since he's on the call. We're doing this work in partnership with Whatcom Unified Strategic Planning Group, which includes Steve Hollenhorst, who I believe is on the call, and he's the dean at Huxley at Western Washington, and he's been really helpful. He's bringing together the strategic planning team to help with some of the research. They'll be looking, and Bill's going to be involved with this too, which is great. Thank you for taking that on, Bill, but really looking at what are other jurisdictions doing in terms of guidance, what are national and state associations providing to their memberships in terms of guidance, and what are we getting from the governor. And also the health department is already doing kind of one-off guidance. People can call and ask a question of one of our communicable disease nurses. So we're also compiling what advice and guidance they've provided on a one-off basis for individual businesses. So we can really be coordinated in our approach and make sure that everyone who's providing guidance and having conversations is on the same page. But that's a really important body of work as we prepare to work with sectors and come up with some shared goals and guidance for them. So thank you, Bill.
My pleasure. Thank you so much.
Like I was saying earlier, I think in order to get through this very difficult, unusual time in our period, we absolutely have to understand what's going on medically and scientifically and research based, because without human life, we really don't have anything else. So we need to keep our members of our community safe, all members safe, which include workers as well as community at large. But everything that we do, we are going to base it on the research-based, medically sound practice. But this task force is going to be, we're creating this in order to help the community move forward, and give structure, so that people know what is a safe practice. How do I keep myself safe, and how do I keep you safe, so that as a community as a whole we can be healthy, and move out of this medical disaster that we're in. Although I have to say, Whatcom County we've been pretty lucky. We're not one of the worst ones to have been hit. But we still have our losses, and it would be better if we didn't have any. But we have to move on with what we do have. But we need to do it with thought, science, and together. And we can't do it together if we don't understand what everyone else is thinking. So we need to have all the voices heard, and make decisions thoughtfully, and then to move on. But we need to make thoughtful recommendations as the task force, and that's kind of our goal to get there, to move our community forward. Any other public comments? I feel like compared to last week, we only have 23 people in hall. We had like over 100 last week.
There are no public comments in the chat box right now.
Yeah, I don't see any. Okay, so do you guys, members, have anything else you guys want to discuss, point to ask? Laura, what do you think? Erica?
Only that I can't remember, China, if you mentioned that the health board, the county council acting as the health board, will vote on a resolution on Tuesday at 1 o'clock at their meeting. So that is, there was some confusion about whether or not they needed to approve a resolution or if we could move forward. And so we're going to err on the side of being very thorough and have them approve through resolution this task force before we take any additional steps. So that's how that hiccup occurred.
I was just going through the agenda. Is it agenda number 6, item number 6 on the list, or is it number 9? I was a little bit confused. Or you can email me back later if
it's actually still being reviewed by our legal counsel, so it's not on
it's
the
not
agenda.
on there?
Yeah, it will be after 3 o'clock today.
Okay, all right, sounds good. Sounds good. Okay, well then, I think I'm going to adjourn the meeting. I think this is the world's fastest meeting I've ever been in, but are you guys okay with that? Okay, so then I am adjourning the meeting, and the next Public Health Advisory Board is on July 2nd. And it's nice to see everyone. Thank you for coming. Thank you for joining us. I think Tammy put out there, so if there's any more questions or comments or information you guys are looking for, there is the website Tammy put out on the chat box, so you can access that information through there. So thank you, and we'll see you next time.
Thank you.
Thanks, Gina.